as most of you guys know, I've already done a Deca Unleashed video. There's been a ton of people though, or I've seen people, asking for an NPP Unleashed video. So this is what I'm going to do, guys. For those of you that don't know, most of you do know this, Deca is nandrolone decoinate, and NPP is still nandrolone, just with a shorter ester attached onto it, the phenylpropionate ester. So what we're going to do, guys, is we're going to do NPP Unleashed, but this is how we're going to do it. I am going to give you guys everything you need to know with NPP on how it's different than Deca, and then what I'm going to do is I'm going to plug the Deca Unleashed video onto this video, kind of as an add-on, because the Deca Unleashed video I think was around 45 minutes to an hour. So I don't need to talk about all the same things. Again, nandrolone, it's the same exact hormone with NPP as it is with Deca. It is still nandrolone, it has all the same effects, but today we're going to be talking about just the differences when talking about the ester and what this plays out in the real world. Having said that, guys, let's get started. And then if you, like I said, you can watch the Deca video after this. Let's go. So what's the big difference between NPP and Deca durabolin? Half-life, guys. The half-life of NPP in the latest literature we have is 2 to 3 day half-life with NPP, nandrolone phenylpropionate, when compared to nandrolone decoinate, also known as Deca durabolin, with a half-life of 15 days. Now, what does this mean? This means that NPP spikes harder, faster, much faster than Deca. Now, I want to put this in perspective with you guys. It does not matter which one you use. It matters depending on how you take it and how much you take. Because you could get a bigger, faster spike with Deca if you really wanted to, and get a lower one with NPP. If you took tons into, I'm not telling anyone to do this, I'm giving an example, an illustration here. If you took 1,000 milligrams of Deca on day 1, day 2 and 3, you would be much higher than a lower dose of NPP for that matter. So we're just talking the differences in pharmacokinetics, how these esters are released. Let's get into the pros, then we'll go into the cons with NPP versus Deca durabolin with the longer 15-day half-life. Pros with NPP: you can pull it out of your system rapidly. Now this is nice because of what? Because if you have sides from Deca, which most people are going to have sides. Again, you're gonna, after this video, after this this beginning, I'm going to show you guys, I'm just going to plug in the Deca video and you guys can watch all the tons of nasty sides with Deca. We're talking anything from, anxiety, depression, mood problems to things like, Deca. It's been shown in medical studies to be 11 times worse on your heart and arteries and blood vessels than testosterone. Go watch I posted an entire video on this. I posted the study on this channel already. So guys, the thing is that in terms of sides, negative sides with Deca, and again, I would never advise anybody, don't use NPP, don't use Deca, don't use nandrolone in general. It's way more dangerous than testosterone. I would put on the same level as trenbolone or worse. We'll talk about that in another video when we do a Trenbolone Unleashed video. Having said that, I still want to put out this Unleashed video for you guys. The pros of NPP: you can pull it out of your system rapidly when sides develop. That's first and foremost. Second pro, you can see the cons arising when you would not see them as much with Deca. The problem with Deca durabolin, guys, is it's the same thing with let's take the frog in hot water illustration. Everybody knows this. If you take a frog and you throw it in boiling water, it's going to jump out, right? However, if you put a frog in lukewarm water and slowly turn up the temperature, you cook it alive, you kill it. Everybody knows this, all right? It's the same thing with Deca versus NPP, quite literally, all right? So with Deca, people start their cycles and levels start off super low. And usually they're using testosterone alongside Deca, most cases. So the testosterone levels, decent amount, and DECA slowly starts creeping up. And the problem is it happens, guys, so slowly, they don't notice all of the terrible negatives and the terrible cons with DECA, with nandrolone. So, and then they keep using it and they feel like garbage. They have anxiety, depression, confidence loss, and then besides all the mental effects, we're talking sexual dysfunction and health effects from DECA, bloat, all this other stuff. But everything comes in really slow, unless they front load. And front loading, guys, is basically just where you take a huge amount the first day to get levels up to where they want to with a longer ester. I do not advise that either. That comes with a host of problems that we'll talk about also. And it's also kind of bad for muscle gain because you want to slowly increase. You'll get more gains that way versus just spiking up, all right? That's talking about androgen receptor desensitization. Go watch that video. I did a video on androgen receptor desensitization, how to increase androgen receptor sensitivity. That was one of the first videos I did on this channel. Anyways, so with NPP, one of the pros is you can see the cons because it's like throwing a frog in boiling water. With DECA, it's more like slowly turning up the heat unless you front load. Moving on. With NPP, rapid release. NPP hits hard and it hits fast, all right? NPP, again, 2 to 3 day half-life. If you want to cut in the middle, 2.5 day half-life. That's extremely fast, all right? That's an extremely rapid half-life. You take that injection, by the next day, you'll be spiked up, all right? You'll be feeling it. So the thing is that it's nice because in terms of muscle gain, you're going to get all the pros right away. And also you'll get to see how bad the cons are immediately. So NPP, if people ask me, and I'll tell people, do not use NPP, don't use DECA, don't use nandrolone in general. It's way too bad for you. Forget the sexual dysfunction, forget about the mood problems, forget about all this other stuff. And there's people who claim it doesn't bother them, and I believe them, all right? Some people just don't get the same effects as other people. Having said all that, bottom line, again, based on the latest medical studies and research, I already published it on this channel. You can go and watch it for yourself. I think the video title is Study DECA is 11 times worse than testosterone. You can watch that video. I published the study. But the bottom line is that whether you notice the sides or not, whether you see the effects or not, NPP is being shown to be 11 times worse heart, arteries, blood vessels, all right? So, guys, I would personally, what I would do, you guys make your best decisions you can, with your doctor. But personally, my professional recommendation is the same one that I do myself. I will never touch nandrolone or I'll never touch any 19 NORs. Again, no nandrolone, no nothing, all right? So just for that reason, all right? So anyways, moving on. We talked about the pros. Let's talk about the cons with NPP. You're more prone to sides. I kind of explain this because you're spiking up levels right away and you're getting them, versus a slower onset. Usually what people do, you know what doctors do when they prescribe TRT with older patients? You're not going to have this problem if you're at Prometheus HRT and you're younger and healthy. They'll just put you right up to the very peak right away. But with older patients, what they'll do is they'll slowly increase their testosterone levels. All right? No problem. That mitigates sides, gets their body used to the hormone. Now, in regards to, and that's a good thing, but in regards to NPP, taking a really short ester, boom, and you're all the way up right away within a day, you're going to be prone to a lot more sides, and it's just going to hit harder, in terms of negative side effects. Moving on to the cons. More frequent injections. Now, this isn't such a big deal because if you're like me, I do TRT, HRT through Prometheus, HRT. I just posted my cycle to this channel. You can watch that if you want. But in terms of HRT, TRT, I opt out for every other day. I inject my doctor prescribed testosterone every other day. And that's the best way to do it, in my opinion. My doctors agree, but most people don't want to do it every other day. Of course, I don't mind really doing it every other day because I just use an insulin syringe. I'm lean, healthy. I use a 1/2-inch 29 gauge insulin syringe. I'll have to make a video on that. People probably want to know that. And That's a great way of taking testosterone. Having said that, one of the cons with NPP is more frequent injection. Guys, that's NPP Unleashed. I'm gonna attach now Deca Durabilin Unleashed starting right now because again, this Unleashed video I already covered with this. In these first 10 minutes, I covered everything different, pros and cons with NPP versus Deca. So now you guys have them, and now you can watch the Deca Durabilin Unleashed video. Why? Because NPP is the same as Deca Durabilin. It's the same active hormone. It's nandrolone. So guys, buckle up and enjoy, and we are out of here. Yeah, what's going on, guys? Seth Spartan here, nutrition training and hormone expert and Prometheus Pro bodybuilder with Prometheus HRT, the world's best testosterone and hormone replacement clinic. Use my code Spartan to save on either testosterone or HGH replacement therapy. Guys, today we're going to be talking about Deca Durabilin Unleashed like you've never heard it before. Guys, we're going to be going through all the pros, unbiased, uncensored. Then we're going to go through the cons. Again, unbiased, uncensored, everything you could want to know. We're going to go through dosing, and then we're going to finish up with any extra additional information that nobody knows and that nobody is talking about. So guys, without any further ado, let's get right into it. So I want to note, guys, I want to go on the record here. Make sure you stick around for when I go through the cons. There are a lot of crazy, terrible, severe, damaging cons with Deca. Most people have no idea that Deca arguably is worse than even a drug like Trenbolone. What did you say? People think it's mild, lesser side effects. And to one extent, on the outside, that's true. But Deca Durabilin is this silenced gun hormone, okay? It appears like it's safe, it's soft. Oh, you don't have many side effects. But guys, it does terrible, terrible things to the heart. Based on some of the best recent medical studies we have, this drug is 11 times more dangerous than testosterone in terms of heart damage and heart issues to the lining of the blood vessels. We're going to get into that in a second. Let's go through the pros. Here we go. Deca Durabilin Unleashed like you've never heard it before. Starting with the pros. Anabolic androgenic rating or ratio of 125 to 37 androgenic. What does this mean? This means on paper, using the regular scientific method or rating system to rate anabolic steroids, both the anabolic and androgenic component. Anabolic 125, meaning that it is about 1/4 more anabolic than testosterone, milligram per milligram. Going over to the androgenic side, with a 37 rating, guys, it's less than half of testosterone in terms of androgenic side effects. We're talking about secondary sex characteristics, hair growth, deepening of the voice, pit hair, anything that encompasses secondary sex characteristics. We're talking about a 37, which is about 1/3 of the androgenic component of testosterone. And this, guys, we're going to talk more on this in a second, but this, guys, is because when Deca Durabilin, the base hormone is nandrolone, when nandrolone enters the bloodstream, it's going to convert not into DHT like dihydrotestosterone via the 5-alpha reductase enzyme, but it's going to convert into DHN, dihydronandrolone. And DHN is an extremely, extremely weak androgen for that matter. So that's where that weaker androgenic rating comes from. No DHT conversion or into a strong metabolite converts into the extremely weak DHN. Now this has some problems with fat loss and other things, and also this is going to cause some huge issues we're going to talk about in the con side on both mood and also sexual functioning. We'll get into that in the cons, but let's keep moving forward with the pros. Okay, we addressed the anabolic androgenic ratio rating system. What is Deca Durabilin? Deca Durabilin is a 19-nor derivative. Remember, the base compound is nandrolone. So nandrolone, Deca Durabilin, is a 19-nor derivative anabolic steroid. What does this mean? This means that the perks of The reason that's over in the pro side to begin with is because a 19-nor derivative steroid is going to have less conversion into estrogen, about 20% compared to testosterone. So then that's another reason they do this. So 19-nor derivative, less conversion into estrogen. Some 19-nor derivatives, almost no conversion, depending on the chemical structure and its binding for the aromatase enzyme. But when we're talking about decadurabolin, about 20% estrogen conversion compared to testosterone. And also, this is going to make it more anabolic, just on a baseline being a 19-nor derivative. So this is what gives it its slight bump in anabolic rating and also gives it its low estrogen conversion. That's why it's in the pros. This comes with many cons. We'll get into that in a little bit. Next, moving down the line, this has to be talked about, and everybody's waiting for this. Joints, tendons, ligaments. Decadurabolin is one of those anabolic steroids that, namely, guys, everybody talks about for joint relief. Oh, it lubes the joints. It feels good. It's the steroid for the joints. You don't have joint pain, all this other stuff, right? Why? Why do people say these things? Well, it's not really, the lubing the joints that pulls water into the joints. This is not really the case. Although maybe it may be a little bit of the case, just because DECA causes water retention, not really through estrogen, but because it is a progestin, which means it attaches onto progesterone receptor sites, and it can cause a little retention that way. But outside of that, the main reason for this lubing the joints is going to be caused why? Because the anabolic steroid decadurabolin causes collagen synthesis much higher than testosterone or any other anabolic steroids for that matter. Period. So, joints, tendon, ligaments, healing, increased collagen synthesis in these tissues. So this is what's going to give DECA its almost seemingly magical joint repair, healing, comfort effects, if you want to call it that. And it's really, guys, it's not just taking away the symptoms. A lot of people don't know this. They think it's just, it takes away the symptoms. DECA actually does heal the joints. Okay? Needs to be said. We'll give credit where credit is due. Again, unbiased, uncensored. Moving on. Decadurabolin Unleashed. Low androgenic ratio or rating. Now, why is this in the pros? We're not really going to talk about, it doesn't have much of an anabolic boost. Not in the real world and not on paper. So we're not going to add that to the pros. However, guys, it does have an extremely low androgenic ratio. What does this mean? This means androgenic sides such as, and this is a huge list. Please, this is a huge list. Go watch my video on Testosterone Unleashed if you want me to go through tons and tons of androgenic side effects. Let me give you a few, though. What are some androgenic side effects from high amounts of androgens in the male body? High blood pressure, number one. High blood pressure, and then from the high blood pressure, you can have kidney damage. Now that's if androgens are really high. But high blood pressure from androgens, oily skin. You can have DHT acne, is what you can call it. So high blood pressure, DHT acne. You can have excessive hair growth. Insomnia, it can give you anxiety. That's usually not unless it's at higher dosages, and other DHT androgen side effects. So being low androgenic, again, by nature, converts instead of into DHT via the 5-alpha reductase enzyme, it converts into what? DHN, dihydronandrolone. Okay, moving on in the pros. Osteoporosis drug. What does this mean? It means DECA is commonly, not just commonly, DECA is well known by doctors and physicians, same thing I guess, doctors and clinics and medical centers inside the medical world. DECA causes what? Calcium synthesis in bone tissue, which means that this drug is an excellent drug for treating osteoporosis. Now granted, if we're talking, comparing this to testosterone, it's not really, testosterone and DECA in terms of bone synthesis. One could argue testosterone does a better job. Putting it out here, okay? However, you're not going to give testosterone unless it's microdosing to women, and you're definitely not going to give it to children. So with DECA, in small dosages, again under doctor supervision, you can microdose or small dose women and children for treatment of osteoporosis or weak bones. Okay? Has to be said. Okay, moving on in the pros. 15-day half-life. Decadurabolin boasts a 15-day half-life in its natural form. We'll also talk about NPP in a different video just because I want to keep things moving. I did my Testosterone Unleashed video. Guys, we got everything out, but it was about an hour long. So talking about getting everything you need to know in one video, we did that. So, and guys, again, the whole purpose of these videos is to give you everything you need to know in one video and then get you guys on your way. So with a 15-day half-life with regular decadurabolin, we are talking about the decoinate ester attached onto nandrolone. And guys, really, a 15-day half-life is going to do a couple things. It's going to give you a slow release into the bloodstream. It's going to be easier to control in terms of size, but there's a major drawback. It's hard to get out of your body if you're having bad sides. And also, you do have to, or you don't have to, but front loading would be recommended. Do not front load if you're doing an actual cycle. I'm talking about with doctors and dosages that way. Small dosages, front loading would be advised. Guys, that's pretty much it. I really wanted to talk about all the pros. I want to keep this video, again, not skewing it to the left or to the right, unbiased, uncensored. We're going to get into the cons now, since this is really all the pros that you can talk about with DECA. Okay, it's a good mass builder for the most part, but the reason that it's not listed under the pros is because testosterone does a much, much better job of building muscle than DECA. Why? You can dose it a lot higher. So, and it's only on paper and real world slightly more anabolic than testosterone, but overall testosterone is going to build more muscle. So it's not really worth putting into the pros as an amazing muscle builder. All right, so moving on now, guys, into the cons. Stay with me. Things are going to get really intense really fast. So let's go into the cons. Here we go, DECA Unleashed. Cons with DECA. Plaque buildup in the arteries and cardiovascular disease and heart wall thickening. This is the worst, the absolute worst side effect with decadurabolin. And guys, namely, this is the worst side effect with every single anabolic steroid, either misuse or abuse. The big problem here, guys, I can't stress this enough. The big problem here with DECA is what? DECA, compared to testosterone, 11 times more damage to the heart and blood vessels. We're talking about the lining of the arteries, the lining of blood vessels. Mind blown. Absolutely mind blown. So 1,000 milligrams of testosterone comparable to 1,000 milligrams testosterone, 1,000 milligrams of DECA. That's about the equivalent of taking 11,000 milligrams of testosterone. Mind blown. And you wonder why bodybuilders are dropping dead. I mean, this is. We need more information on this, but based on a recent Italian study done. Nandrolone stops epithelial cells from growing 11 times fast at an 11 times lower dosage than testosterone. What does this mean? It damages blood vessels 11 times faster. Boom. I mean, it's nuts. People, we didn't know this until recently. So, in terms of, what can I say? In layman's terms, guys, I guess I want to just wrap this point up and move on, but it's a huge point, so I should make a big deal out of it. If you're taking 100 milligrams of Deca, that's just as bad as taking 1,100 milligrams of testosterone in terms of damaging your heart and arteries. All right? Silence added for emphasis. All right, moving on. All right, we talked about plaque buildup in the arteries, cardiovascular disease, and heart wall thickening. I guess I didn't really talk on the heart wall thickening. Heart wall thickening refers to what? It refers to when you abuse or misuse anabolic steroids at their respective dosages, and the heart wall actually gets thicker. It hypertrophies, which does what? It makes the heart not able to pump as much blood out, thereby what? Decreasing the overall working cardiovascular ejection volume of blood that you can eject into your body. So it's in layman's terms, you have a weaker heart. All right. So this one is not going to be as big of a deal. The heart wall thickening is probably right around that of testosterone, so it's not a bigger deal. The big problem with Deca is what, like we talked about, plaque buildup in the arteries and cardiovascular disease. All right, we talked about that. Moving on. All right, guys, progestin sides. Now, this needs to be talked about because with testosterone, you take large amounts of testosterone, what's going to happen? Estrogens are going to spike through the roof, and it's going to cause lots of estrogen side effects, right? You don't have that problem with Deca because the conversion is 20%. So unless you are taking grams, guys, not milligrams, grams of Deca, you're not really going to have a problem with what? Estrogen conversion, right? So that's not the case. What is the case is that Deca-durabolin by nature is a 19-nor derivative, which makes it a progestin, which means that what? It's going to bind to progesterone receptor sites. This is going to cause not estrogen issues or high estrogen issues. This is going to cause high prolactin issues. You can get prolactin gyno. You can get water retention from prolactin. You can get a myriad of nasty high progestin side effects from taking Deca. All right, and it's extremely difficult to control these side effects. Why? Because Deca is attaching onto those progesterone receptor sites. Again, it's progestin. Guys, and go to Google, type in progesterone, high progesterone side effects in either men or women, and you can look at this list for yourself. My personal opinion, don't touch this stupid hormone. Please, just save yourself some pain and suffering. Don't touch it. All right? It is way more deadly than testosterone, and it can be argued that Deca is more deadly than trenbolone, okay, in terms of beating up your body. Moving on. Guys, next on the list of cons is mood side effects. We're talking anxiety, depression, feeling just like a piece of garbage. You just the opposite of, well-being, okay? Why? Two reasons for this. Reason number one is because Deca-durabolin is by nature a progesterone. You're going to have the symptoms, or you can have the symptoms of high progesterone in men, and that is nasty. It is absolutely nasty, okay? So you're going to have terrible mood side effects from the progesterone. We're not done. And then you're going to have terrible side effects from DHN, the conversion of nandrolone into dihydronandrolone. What does this mean, guys? This basically means that DHN molecule, dihydronandrolone, after the nandrolone converts via the 5-alpha reductase enzyme, it means that the DHN is going to float and attach onto your brain, because we have androgen receptor sites in our brain. And the problem with DHN is that it has almost no androgenic component to it, which means what? What does this mean? Low confidence, low self-esteem. You don't feel good. You feel like a weak beta male. Okay, that's the best way I could put this into terms. I mean, that's not medical terminology, but that's the best way I can put it. 300 milligrams of testosterone versus 300 milligrams of Deca, day and night. 300 milligrams of regular pharmaceutical grade testosterone is going to make you feel like $1 million. You're going to feel amazing, happy, confident. 300 milligrams of just Deca, you're going to feel like just a depressed slob. Okay, I'm just being blunt, honest with you guys. And there's a lot of people that are saying, oh no, Deca, you know, I feel good on Deca. Guys, a lot of Deca is really just testosterone, unless you're getting it from a pharmacy. Okay, I'm just giving it to you guys how it is. Moving on, Deca Unleashed. Severe sexual side effects. And this is why, because it converts to DHN, dihydronandrolone. So what happens is, in the male anatomy, so now you have DHN attaching not only into the brain, you know, giving you the side effects we talked about with, you know, mood problems, anxiety, depression, you know, oh, just you're a weak male feeling, but also it's going to attach onto your penile tissue. Moving on. We talked about this a little bit. Decadurabolin is the silenced gun hormone. What does this mean? It means on the surface, when people talk about Deca and when people compare what it was like being on Deca, they say, oh, I didn't have barely any sides. Oh, it's so mild. It's so nice. On the surface, Deca is the nicest, kindest, want-to-be-your-friend hormone, anabolic steroid, but it is wicked. It is absolutely wicked and harsh on your body. Why? We talked about Decadurabolin causes 11 times the damage of testosterone to your heart and surrounding tissues and blood vessels, but it can be argued that it could cause you 11 times the damage to your heart and cardiovascular health. We're talking about cardiovascular disease, guys. So Deca is not a friendly, mild anabolic steroid. It is a nasty, nasty drug. Okay, it's a nasty anabolic steroid. And it's going to cause, you might be nice on the surface. You might even not have such bad side effects with Deca. But one thing you're going to have is it's going to be destroying your health from the inside out. Again, silence gun hormone. Moving on. All right. Man, this hormone's stressing me out as it is. Let's go on. Worse, the medical studies, guys, it is worse on cholesterol and lipid profile than testosterone. Milligram per milligram. Deca is worse on your cholesterol and lipid profile, HDL to LDL, than testosterone. Well, go figure. It's a 19-nor, it's a nandrolone. So, you know, obviously, this you know, and then we confirm it by medical studies. Terrible shutdown from Deca. It is a nandrolone. 19-nor nandrolone. What does this mean? Female birth control. A lot of the time, you've heard of progestin birth control for women. Well, not only do you get the shutdown, why? Not only do you get the androgenic shutdown because Deca still binds onto androgen receptor sites in the brain, shutting down natural testosterone that way. Not only do you get that because it is it attaches onto androgen receptor sites. So not only do you get the shutdown from that, but you also get shut down because it's a progestin. Progestins shut down the release of LH and FSH from the pituitary gland, which is going to stimulate your testicles to produce testosterone. So what does this mean? You're going to get two kinds of shutdown in your brain, and altogether, medical studies show, again, guys, that Decadurabolin shuts you down more milligram per milligram than testosterone. Point. Emphasis added. Moving on in the cons. Terrible for strength gains. Now, there's going to be some people that fight me on this, and I already know what I'm going to tell you. Either one, you think you're using Deca and you're really using testosterone. Okay, because testosterone is the best anabolic steroid in the world for strength gains. Again, not for immediate, like taking it right before a meet. There's other drugs that people do for that, but I'm talking about the greatest. Testosterone is the greatest anabolic steroid for strength gains, period. Okay, just that's how it is. So it's terrible for strength gains. Why? Number one, you guys already know what I'm going to say. It converts from nandrolone into not DHT, DHN, which is one of the weakest androgens on the face of the planet. So not only is it going to, literally kill your male ability, with the male sexual sides we talked about, but what are androgens responsible for? Increased pain tolerance, increased firing power on the central nervous system. So you are taking an absolute axe to your strength gains. And the people, again, that are fighting me, a lot of the time, DECA isn't DECA, it's testosterone, or it's mixed with testosterone. And even more of the time, let's say you are, let's say you do make some strength gains, it's possible to make some strength gains with DECA. I mean, it's anabolic, but a lot of the strength gains are because it's a progesterone and it's making you hold water. So more water, you have more weight to throw around. Anybody who's ever lifted a weight knows that it's much easier. The heavier you weigh, the easier it is to lift, whether it's bench, squat, curling, anything. Moving on. DECA is terrible for strength gains. We addressed that. All right, guys, we're going to move into dosing now. Crazy video. There's just so much stuff to talk about with this. Of course, this is still a lot shorter than my testosterone video. So let's get into this. Dosing. Guys, dosing. My personal opinion to you and my personal plea to you, never use this drug. If you care about living, if you care about your health, if you care about your body at all, do not use Deca-Durabolin. There are lots of people, again, I'm with a hormone replacement clinic for a reason. A lot of people, they think that, and you can even get Deca-Durabolin with a prescription from Prometheus HRT. Why? Because Deca-Durabolin is, physicians can easily write prescriptions for that. It's been around since almost at the same time of testosterone. So even though my clinic, you can get Deca-Durabolin, a lot of, the physicians there will prescribe it to you if you're healthy. But even that aside, guys, please, that what I'm telling you is not, it has no, there's no value for me to tell you what I'm telling you, except, because I'm being legitimate and honest with you guys. My personal opinion and my plea to you guys, never use Deca-Durabolin. Why? Because even though it might seem like the nicest anabolic steroid in the world, it is going to destroy your health. And, these studies that are showing 11 times, DECA causes 11 times the damage than testosterone to your heart and arteries and blood vessels. Is this drug worth using? Absolutely not. Why? Because we already know that testosterone at a high dose just causes plaque buildup in the arteries. So if you care about living, if you care about not dying, if you care about your health, don't use DECA, okay? But if you don't care, then I'll give you a dosage, but I'm not telling you to do this. I'm going to give you a dosage just because this is Deca-Durabolin Unleashed. So if you don't care about living, if you don't care about your health, I wrote here up to 750 milligrams per week. Why no higher? Because DECA cannot and will not be utilized, at a higher rate like testosterone. What does this mean? You can't take as much Deca-Durabolin and have your body use all of it like you could of testosterone. We see that testosterone, your body can just keep sucking it up, sucking it up, sucking it up, sucking it up. It's your body's natural hormone. You can get bigger, stronger, faster. Testosterone is the best anabolic steroid for size, strength, and everything total. Okay, why? Not because it's the strongest milligram per milligram, but because your body can utilize the most of it. I talk about this in my testosterone video. We see with Anadrol, other anabolic steroids that have a much higher anabolic rating than testosterone, they cap out. They you get the gains, and then all of a sudden you take a higher dosage and there's no benefit. With testosterone, even at 600 milligrams a week, you get a little bit of loss in efficiency at building muscle or effectiveness at building muscle, but your body is able to utilize much higher doses of testosterone than any other anabolic steroid. And, based on what I know, it's the same way with DECA. So what is the point of going above 700, anything over 750, unless you're running DECA alone? There's no reason to go higher than 750. You want to make those gains off of testosterone. Again, I'm not telling you guys to do that. I would tell you guys, if you care about your health, don't go over 250 milligrams of testosterone, for continuous usage. I talked to my doctor, my physician at Prometheus HRT. 500 milligrams of testosterone can be used short-term safely, but again, that's not something you want to do. Even 500 milligrams for years and years and years, you're going to be causing, again, what we talked about, plaque buildup in the arteries, cardiovascular disease, and heart wall thickening. Guys, I'm going to finish up with some things, some extra things you need to know about DECA that nobody else is talking about, and then we are out of here. Here we go. So, extra. DECA. DECA is one of the most famous bodybuilding drugs of all time. Arnold Schwarzenegger, Dorian Yates, golden era bodybuilders, and even today, people are still using what? Roll my shoulders a little bit. DECA Durabolin. DECA is extremely popular, and it has been since bodybuilding came out and athletics came out, fitness industry came out. DECA is extremely popular, and that's one of the only steroids they had at the time. Test, DECA, Primabol, and Dianabol. That's pretty much all they had in the golden era. So obviously DECA was up there. However, guys, you already know what I'm going to say. They had no idea the damage DECA does to the heart and arteries and blood vessels. We know now, based on that Italian study that came out. Having said that, that's the reason it's famous today. But if you're a bodybuilder and you care about your health, testosterone only, guys. Really, honestly, testosterone only or low dose. Anavar, Anadrol. You can get these things from Prometheus HRT with a prescription from a doctor, pharmaceutical grade, as long as you qualify. But testosterone is the only safe anabolic steroid to take long term. With Anadrol, Anavar, other things, or even testosterone at slightly higher dosages for short periods of time. Otherwise, guys, other than that, it's misuse or abuse. Again, do everything through your doctor safely and legally. Finishing out, guys, another thing is that you may or may not know, people use DECA a lot of the time as a Winstrol counter. They use DECA to counter the nasty dry joints effect from Winstrol. So this is not Winstrol Unleashed video. We will do a Winstrol Unleashed video. But I will tell you this, Winstrol causes dry, achy joints, the dry joints effect. Why? Because Winstrol actually binds onto what? Estrogen receptor sites all over the body, everywhere in the body, including the ones in the joint capsules that produce synovial fluid. Winstrol attaches on there and basically causes an anti-estrogenic effect. Much like Nolvadex. You take a lot of Nolvadex, you're going to have dry joints. The same sort of thing with Winstrol. Winstrol actually attaches onto and binds to estrogen receptor sites everywhere in the body. This is what gives you the shrink-wrapped look, but it also gives you the dry and painful joints. So what people do a lot of times is they take DECA and Winstrol together, which is extremely stupid because you're going to get some progestin water weight from doing that. But that's something that has to be said, that people use DECA in combination with Winstrol to take off the sides, but it's pretty much pointless because the pain from Winstrol is not from problems with the joints and tendons, ligaments. The problem from Winstrol is that you take Winstrol and it's going to reduce the amount of synovial fluid in your joints. Why? Because Winstrol is blocking the aromatase enzyme from converting testosterone into estrogen in the joints. Completely different thing, but we'll get into that in the Winstrol Unleashed video. Guys, this is DECA Durabolin Unleashed. Everything you could ever want to know in one video. DECA Durabolin Unleashed like you've never heard it before. Seth Spartan, stay safe, stay healthy, do everything right, and we are out of here.